And at this point, I'd like to continue where we started yesterday, talking about our products. Once again, this morning we're going to be talking about FastFlow. And to get us started, I'm going to turn it over to Tom Holt, our VP of Products.
All right, hello. Just give me a second here. I'm going to go ahead and share my screen as soon as I have the bouncing ball. There we go. And okay. So I just wanted to give you another overview of a different part of our product line. But before we do that, I just wanted to recap a little bit of what we talked about yesterday, in case you weren't here, or just to remind you of some of the things we talked about. The first thing I wanted to do is we had some great questions come through yesterday, and so I wanted to make sure that you didn't get an opportunity to hear the answer to those questions, or if you needed help remembering what we talked about, I thought I'd go ahead and go through a few of those first before we get into the regular meat of what I'm getting ready to talk about. So let's just dive into that. Some of the questions we had were around devices and around eSig, mobile eSig especially. Does it support Android? Does it support Surface Pro? And the answer to that is yes, we support Android, Surface Pro, iPad. All of those are in use in various places and have been tested with our software. So that's an affirmative there. Also, I had a question about using mobile devices at registration, and I can tell you that is not only possible, but we definitely have hospitals doing that. And then a third question was around IE11. So IE11, as you know, is a browser. It came out recently. It's not actually the newest Microsoft browser, but it is the newest one in the line of browsers named Internet Explorer, and absolutely we support that. We support on our newest version of our web-based products, we support IE 9, 10, 11, and Chrome. And then we also support IE 8, but we don't recommend it because it's no longer supported by Microsoft. And in order to use IE 8, you would have to drop back to an earlier version of our software, but we do continue to support that version for those people that are unable to move off of IE 8 yet. And then we also had a question about obtaining a print copy of a signed form of it at admissions. And so I just wanted to talk about that real briefly because I wanted to make sure that everybody understands that you can absolutely get a signed copy of the form after the signature has been applied in both the desktop signature client, the capture client, and the mobile signature client. It is possible to print that out for the use case of giving it to the patient. So we realize that that's an important use case, and it is totally supported by our software. So I want to dive in a little bit to just recap some of the themes that we talked about yesterday. The themes, these are the themes that we have been using in determining what features and what capabilities to add into our software over the past year or so, and we are continuing to follow these themes. I think these are pretty universal, but let's talk about them real quickly. Scalability. We are finding that more and more of our customers are using our software in larger and larger ways with more users, with more data. So we are increasing our ability to scale into these larger organizations. Usability is another important theme, and this speaks to the ability not only to decrease training time, but also to decrease the amount of time it takes to do a task in the software. We're increasing our security. That's always a concern for us. We want to make it as secure as possible. There is no such thing as a completely secure software piece of software, but it is top of mind. Mobility. This is another thing that we are continuing to see as a trend. More and more of our customers are wanting to know how they can use our software on mobile devices, whether they be handhelds or tablets, and we are definitely supporting that trend. And then interoperability. You know, as I said yesterday, and as I'm sure you know, we can integrate with every major vendor. I think we have integrated with every major vendor of EMR and other hospital systems. I'm sure there are some out there that we have not done yet and that we certainly can, but we want to make that as easy as possible. We want to make those integrations go very, very smoothly, and so we are continuing to put effort into making that interoperability better. There have been 3 releases since last year. The current is 6.3. We synchronize our releases so that if you are using either web form imprint, FastPrint, eSig, or if you're using FastFlow, if you're using those things together, you would want to make sure that they're all in the same version because that's how they're tested. And so let's talk about FastFlow and what's new in FastFlow. So the first thing that I want to talk about, and this is actually not something that happened last year, but it happened a little bit before that, a little bit before the last user group meeting last year. But if you missed that, or if you haven't been keeping track, I really want to emphasize that we have a new user interface in FastFlow that is much better in many ways. The first thing is that it is based on Internet standards. So that means that it does not just work with Internet Explorer. It works with Chrome. It probably also works with other browsers. We don't specifically test on those, but if you have a strong need for that, let us know. And it also, in keeping with our mobility theme, it works on mobile devices. So this is an important change for us, important change potentially for you. So we're pretty excited about it. That's all I can say. Another thing that has happened in the last year is that we have greatly increased our ability to scale. So the latest version is 64-bit, which means that the server that you put this software on can scale up to virtually an unlimited amount of power on that single server. We also are supporting the ability to scale out. So that means that if you would rather than building one very, very large server to support a large implementation, if you would like to support that with multiple low-cost servers, that is also a possibility. So we can do web farms, and that gives you the added benefit of a bit of redundancy on those servers. So as you know, in a web farm situation, if one of your farm servers goes down for some reason, the other ones pick up the slack, and you keep on trucking. So that's a pretty exciting capability. We've also done some improvements to the administration page. One of those, I'll just highlight one of them, is around scheduled tasks. So now this has been moved to the admin panel and can run a stored procedure, which gives us a lot of power to allow things to happen within the database that you might want to do. Another thing that we've done this is actually part of administration, is we've added a diagnostics page so that if you are talking to customer support for some reason and they ask you a lot of detailed questions about how your system's set up, you used to have to root around and find the answers to those things. Now you can go to one place and even just click a button and it will save it all to a text file, and you can email that out to us and we'll know exactly how your system's set up, since that's all pretty environmentally dependent. Yet another thing that we've improved on is our form viewer. So I just want to take a moment to talk about the form viewer. This is actually a feature that came out in version 6.0. So prior to that, we utilized Adobe Reader. And Adobe Reader is a great piece of software, but it just wasn't customizable enough for what we wanted to do with it, for the user experience that we wanted to give to you. So we wrote our own form viewer and included it in version 6.0 and later of FastFlow. And this allows us to do a number of things. For one thing, it allows you to sign or approve a workflow without leaving the form. We improved the workflow in-flight page around this decreased training time, and it also allows it to work on mobile. So as you know, as you may know, Adobe and Apple don't really get along, and the Adobe Reader would not run on an iPad, and so we wrote our own form viewer to get around that that limitation. One last thing I want to highlight is the Visual Workflow Designer. So that also came out in version 6.0, makes creating a new workflow much simpler, much easier, much more straightforward. But we have not just put that in and gone on to other things. We have continued to improve the experience of using that. We added in some getting started help because it's not necessarily obvious what to do first when you get in there. So we put some help in around that. We've rearranged the controls. We've made the step actions searchable and the names of them visible so that it's very much easier to pick a step action for your step out of what might be a very large number of those. We also give you the ability to print the workflow now so that you can more easily share it with colleagues without bringing up the interface. And we also added the ability to spawn a new workflow from within a step. So I think that's a good set of things. Hopefully you're updated to the latest version. If you aren't, I encourage you to. There's a lot of functionality there that I think you'll get some use out of. And at this point, would like to pass it on to Tim, who is going to show us some ways that you might use this functionality.
Thank you, Tom. So, like Tom mentioned, I'm going to actually talk about and show you some of the functionality of FastFlow. Before we do get started, I do just kind of want to give you a little bit of an overview. Really what we're trying to accomplish here, the easiest way to explain it is to try and replace any of those manila folders you have going around your hospital. So when I say that, I mean, you know, all those processes that you have where you have somebody fill out a form and then it has to get passed down to a bunch of different people for it all to be approved. Obviously, there are tons of different workflows at your hospital that fit that description. Some of the ones that we see most often are like IT access requests, new hire employees, incident reports, and so on. So those are just a couple of our most common areas where we do see our FastFlow come into play. But in no means are we restricted to that. FastFlow has been used for a lot of different requests that are done throughout the hospital. So I think that as more and more customers get more and more comfortable with FastFlow, we'll even see an additional increase in what different workflows we have. The process itself is pretty straightforward. I'll go through a couple of them where we start a document and we'll process that document, and we can see how we can route that document into different areas so that you can see exactly where this could fit into your different areas at your hospital. So I'm going to actually just start. I'm in FastFlow right now. You notice that I have my documents here. I'm on my Documents tab. Oops. Let me just sign back in. It looks like I timed out. So I'm on my Documents tab, and I can see all the documents that I have access to. If you are familiar with any of our products, this is all going to be access-driven as well. So, you know, if I only want to have my HR team see specific documents, I don't want to necessarily have our nurses see new hire employee forms, and I can restrict that based off the access of the user that I'm signed in as. But you can see that as I scroll down, I have all these different workflows here. Pretty straightforward for me to actually start a document. If I did have a new hire, for example, and I needed to start my new employee form, all I would have to do is click the Start button, and that would launch me into my FastFlow form. From here, this is actually a form that we created from one of our other facilities. Pretty straightforward to actually process. You can see that I can just come in here and enter dates or enter information. I also have specific drop-downs. For example, like our facility, I can just select our regional facility or a regional hospital, and I can continue to process everything. The other nice piece about having that defined data, such as the facility, is that I can then mine that data out so I can sort to see exactly where we are within that process. So I can see exactly, are we hiring more people for our regional facility as any of the others? Or along with that, maybe if we want to look at department, if we have a lot of turnover for our nurses, we can see exactly where that information is coming from. Obviously, along with our drop-downs, we have our free text boxes, and you'll notice over on the right, I can actually have a checkbox as well. We'll talk about how those checkboxes can come and play a little bit, but of course, it's just a nice feature to have on our form as well, so I know exactly where I am within this process. Oops. It'd be nice if I followed my own instructions and put the first name in the right field, along with the last name. I'm obviously not going to go through and process all of these fields. There's a lot of information, and at some point it will get pretty redundant for you to actually have to sit here and watch me fill out every single thing. So I'll just put number of hours of 8, and as well as the status of full-time. Notice that I have some larger boxes down at the bottom, again, just to really show the full complexity of how you can build out your forms here, just to have the ability to have full comments and make sure that we're entering all the necessary data for when we are entering a new employee form. I'm going to just quickly approve that one. Again, I'll show you that approve process on my next form, but I did want to just show you a couple different forms. So the next form I wanted to talk about is going to have an incident report. So again, to go back and focus on how robust this functionality can be, we already talked about our new hire as well as our incident report. This form is built a little bit differently, again, just to show you exactly the full capability of our forms. For our incident report, I can just process my incident, which is just a quick radio button, as well as my drop-downs here. Enter my information for my date and time. And I could also have those brief descriptions like we already talked about. Again, I'm not going to bother filling out all this information just for the sake of time and making sure that I don't bore you too much with it. But again, once I do finish out the form, you'll notice that I have my approve button at the top. This is what Tom was just talking about. I can click approve and I can actually just push this form forward and we'll go to the next step, which I'll talk about in a second. Along with that, I could save my documents if I wanted to save it without submitting. Maybe I do want to fill out some more information about the event, but I need to go back and gather more information. I need to talk to the person who's actually involved or talk to the supervisor. I can make sure that I can save this and not lose any of that, any of the information that I already entered. So I'll just approve this document real quick. And you notice that is then going to automatically bring me down to my second tab on the left, which is going to be my workflows. Really what the workflows is going to do is it's going to allow me to have one central spot where I can see everything that's coming to me. So not only can we send forms out to be filled out through FastFlow, but this is actually a good place for all of the forms to be located as well. So again, for example, that incident report, once I clicked approve, it then moved over to the next step in the process. So it's going to actually go over to my boss to actually approve and look at that incident report and determine what we need to do with it going forward. So if I were to log in as my boss, I'd be able to see my inbox and have that new incident report showing right here. Along with that, we have our sent items column. And again, it's going to be the same exact thing as your email sent items. Here you can see that incident report as well as the new employee form that I actually just filled out. So it's going to tell me exactly the name of the report, the description, the date it was sent, and also the activity. So the activity is going to be important. It's going to tell me exactly where that form is. I started off by mentioning the manila folders. So one of the biggest downfalls of that process is passing that manila folder all throughout the office and not knowing exactly where you are within that process for your incident. Through using FastFlow, you have the ability to see exactly where this incident report is. So maybe there's 6 different steps within the workflow for our report. And I can come here and I can see exactly where it is. I can see that it's with the Director of Solution Architect and also the last activity date. So the last activity date is not necessarily the date it was sent, but the date it was last approved by someone else. So again, if we go back and we talk about how FastFlow can have multiple steps through the approval process, I can see exactly when the last process was actually approved. Along with that, I can see all my archives. I don't have any information archived, but if I did archive any of my specific forms, and also department workflows, I can break down all of my different workflows based on the departments where they're sent. So, for example, if I have HR, incident reports, maybe I have some clinical departmental forms as well, I can process those all right within this desktop. So far we've processed the documents. I was able to enter a document. We can see where the documents are housed, either in the sent box or inbox. But the other thing we need to talk about is building out those workflows themselves. And building out the workflows is really going to be what allows us to have multiple different forms and have the forms work so differently to fit into all the different processes at your hospital. Building out the forms are pretty easy. All I have to do is over on the left, I click Advanced, and I have Workflow Admin. And within the Workflow Admin, I can find my workflow that we already started, which is going to be the new employee form. All I would do is click Route, and I'm going to be in my Workflow Designer. The Workflow Designer is a drag and drop process, so it's pretty easy for me to add or remove anything that I need to do here. Here I have the initiator. This is always going to be the first step, obviously. This is going to be the person who starts the document. And then it's going to go over to the next person, which is going to actually be a role-based. So to add a role-based, over on the left, you can see I have my workflow steps. All I would do is I would click and drag to add a new step in my workflow. Releasing that allows me to then add that step in my workflow, which we'll talk about in a second in a little bit. Instead of adding a role, so when we're building out our users, all the users are associated to a role. It's really their job title, whether it's CIO, CMO, physician liaison. All those roles can be built out into your workflow and then having those roles associated here. We do the roles instead of a user more often than not, just because if that role does change, for example, if your CIO or CFO changes, you don't have to go and change anything within the workflow themselves. You're just updating the person who now has that role when you're adding them into FastFlow. Along with that, I could send to a group. So if I drop and send to a group, I can select a group. You can see that all these groups are built out within FastFlow. And I can just make sure I have my patient incident reports, for example. Along with that, I can have group approval. So this is a nice process, again, making sure that we have group approval. Instead of making sure that the entire group approves everything, we could just say, 50% of the group has to approve this step before it moves on any further. So that's going to be a nice process to make sure that we're not limiting. We don't have to get every single person. If you just need one out of the entire group to approve, let's say that it needs to go, this new hire needs to go to the entire C-level suite. As soon as one of my C-level management team approves, we can sign off on it. So I can just put 10%. Let's say that there's 10 C-level managers. Once I have that one person approve, it will move on to the next step. Along with that, another nice one that we should talk about is route variable. Adding a route variable, this is one that we have actually in the incident report. So I select my department, and then I decide where I want that to go next. So instead of having a role defined, depending on who's going to start that incident report, I can move the form to the necessary person. So maybe I need that to go to the initiator supervisor. Instead of having one specific role, obviously that supervisor is constantly going to be changing. So in the hierarchy of your users being built out, you can have that supervisor defined, which is nice. When we're also looking at adding our routes throughout the process, you can see we have our options right below who we're going to add. Adding the options is just going to allow us to have more functionality when we're moving through our workflow. So you can see for our Director of Solution Architect here, we have this little signature pen. That means that this person's actually going to sign off on the document before it moves on to the next step. So when we're looking at our new employee form, we want to make sure that this person is signed off before we move it over to the Director of HR. And that will actually show in the document so we can see that Cliff has signed off on that specific form. Along with that, we have attachments. So I can add an attachment. For example, maybe we have Cliff attach the resume. We can have that here, and that way the resume is seen by the Director of HR or anyone else as we move forward down this process. You can also add a note. So again, for any of these options that I want to do, all I would do is click and drag and drop, and I can add a note, which would allow Cliff to add a secondary note to that document as well. So adding that note, I can then add in additional information. At this point, if we scroll down a little bit further, you'll notice we'll have our final disposition. Once we've gone through the entire workflow, and again, your workflows are completely customizable to determine what information you want to have in here. You can show different information. You can have, there's no limit on how many steps you have. I just have 2 to keep it simple and make sure that we're not going through too long of a process for you here. But once I get down to the final disposition, I have some additional items that I can add to my workflow. For example, I can send this to a database. So if we want to store all of our information in one specific database, especially for our new employee forms, I can do that as well. I can export a TIFF image. I can send a return to a sender. So again, for the new hire employee, if we do have a supervisor waiting to hear back to make sure that everyone has signed off, we can automatically send that back to the sender. We're not waiting for anything to be sent down. Eventually, it's going to automatically happen as soon as that final disposition is reached, as long as we've hit that end of the workflow. And then the last piece is that I could actually email this as well. If I click on my email icon here again, you can see that I can email based off of specific fields as well, which is nice. We can actually also send the information to a specific role based off the information that's entered into the form as well. So let's say that if I add a new person here, I want to add a new role. And I'm going to add the role of nurse, the CNO. I'm going to actually just check off this link, this step to a field. I can add that to this checkbox. Again, if I just go back in and show you what I'm talking about, because I checked off that nursing checkbox, this checkbox here, I may want to route this form only to the CNO based off of this checkbox. So by adding my link this step to a form field, I should say, I have my checkbox, I define my checkbox, and I say is checked. So once this checkbox is checked, it will actually go down to my CNO. If my checkbox is not checked off, then we'll actually just skip this step altogether. So just to quickly point out that you do have a lot of flexibility in these routes. Obviously, depending on what workflows we have, they can get pretty robust, but we have all the logic built into the workflow designer to make sure that we're not overcrowding anyone's desktop, we're not sending anything unnecessarily, and we're able to process all the way through. So again, we talked about our incident reports, our new hire forms. You know, we're not restricted to just behind the scenes. There are a lot of different workflows we can see. A different one that we've seen is for feedback from our physicians within their processes, within the EHR in general. I know a lot of hospitals struggle with capturing feedback from their end users. Having this form built out to allow you to actually process that form down and make sure that we see the entire workflow for it does add a nice level, because we do have those desktops where the physicians or the nurses can actually go in and see exactly where their processes have been. So I'll just show you that one real quick, and then I won't take up too much more of your time. So if I just put in this form, I'm just filling out this form as a physician to be able to ask for additional data to be changed within one of my order sets. So again, we have our physician name. We can have our drop-down. This is just going to be a quick list of different order sets I have within the facility, and quickly define the information that I want changed. and then I can just fill in the rest of my information, click approve, and again, that will move on to the next process in the next stop within my workflow. So again, you can see that item in my sent item box here that we already talked about. And then if I just go back over to the workflows just to give you a quick peek, you can see how we've built out our workflow for our physician order sets as well. We're starting with the initiator. Oops. So we're starting with our initiator, then we go to the physician liaison, physician champion, our director of pharmacy. Again, you can see that our director of pharmacy, this is going to be linked to one of those steps that we just talked about. So because I checked off that the change does involve a medication, we are going to go to the director of pharmacy. So again, just so you can see the full layout of everything that we can do within these processes, again, just clicking on one of these items such as signature, I can drag it over to a role and I can add that to a specific role. So that's a quick overview of our FastFlow product as well. At that point, I guess I'll go back to Aaron and we can continue on.
Thanks, Tim. Great overview. As you can see, FastFlow is a very powerful platform that we can automate a lot of different processes and a lot of different areas. Yancey kind of mentioned it yesterday, all the different departments that we can help automate with FastFlow: HR, risk management, materials management, purchasing processes. So huge potential for FastFlow. We're going to open up for questions now, but I do see that our Director of Solution Architecture has joined us, Cliff Babbitt. Cliff is traveling today, but I'm glad he was able to join. I want to give him a few minutes to share some other information about FastFlow that you might find useful. Cliff, are you there?
I am. Thank you, Aaron. Just to piggyback on some of the great information that Tim shared, for those customers who want a permanent resting place on our side for some of the documentation, we do have a content management module as well, where that can be stored and retrieved. So human resources documentation, a lot of our customers will have that go into an HR repository, maybe even put the final disposition of those forms out into a network drive even, but to take it to an even more automated process, we can put those, index all of the values on that and store that non-patient content on FastFlow CM, and then even use that content to initiate new workflows. So it's all tied into our FastFlow workflow engine. So if you've got a content, like a new hire form that you want to revisit and initiate, as Tom talked about earlier, we can automatically spawn other workflows now as part of that process. But I can also manually go in a year or two later and start a workflow from some of that existing content from CM. And Tim also mentioned some of the reporting aspects, the ability for us to take data off of those forms and make that more useful. So we have dashboards, custom reports that we can create with that data to make that more useful. And things like a content or a dashboard with all of the purchase requisitions that are in process today. Someone in materials management may want to see a high-level view of everything that's been ordered in the last 2 or 3 months and be able to sort through that data to make it more intelligent. And with that, see if there are any questions that have come across as Tim and I went through some of that content.
Excellent. Thanks, Cliff. Yeah, we have a few questions that are coming in. The first question I will direct to either Cliff or Tim, or Tom for that matter. For a FastFlow form, are you able to save the form partially finished and then go back and complete it later before saving the final version? And there's a follow-up to that. Also, are you able to send this form directly to a content management system such as OnBase?
That's a great question. The answer to both of those is yes. We, as Tim had kind of started to show that, you can go in, initiate a form, save it, and come back at any point to continue it. It basically sits in your inbox then until you're ready to pick that up and move on. We do have some customers who are using that in a very simple workflow, either going directly into a document imaging repository like OnBase or ATF or some other document management system. So we can certainly send it as a final disposition. That's one of the things that we can do with the form. Index all those values that are needed to send it directly into that patient folder or a non-patient folder in some other third-party document.
Excellent. A couple questions about form design. The first one is, can we use Form Designer to create the forms?
That is another great question. Yes, we use the same form design platform for all of our applications. So Form Designer can be used to create the fillable forms that you saw in this demo. A lot of our customers will come to us for the design and sort of optimization for the first few forms, because they may be slightly different in an electronic environment. But Form Designer has a lot of robust capabilities to add drop-down lists, checkboxes, pre-text fields to the form.
There's another question that's somewhat related about creating a FastFlow form from a Word document. Can you speak a little bit about how that process goes? You can take the Word version of the form and make that into a FastFlow form, Cliff?
Yeah, that's one of the many ways that we can bring forms in. We have a conversion tool that takes documents in from sources. We can scan in forms as well, but bringing them in as Word or PDF documents initially, we can convert those right into a fillable PDF with Form Designer. And like I said, often we'll be doing some optimizing to maybe take things that I've seen a number of forms where there's a lot of real estate on the form taken up by checkboxes. You got 30 items as checkboxes that could potentially be condensed into a lot smaller area with a drop-down if it's uniquely selecting those items. So absolutely, bringing it in from Word, PDF, Excel, any of those formats will work with our conversion tool.
Next question, are there any workflows for invoice approval?
Invoice approval is a possibility in a couple of different ways we might address that. We have the option for scanning in invoices and using them as part of, with our content management app platform to bring those invoices in and route them to someone for approval. So with content management, that is an option to start with scanned in invoices. Or if we're starting with a form that someone's filling out on FastFlow, they can complete some of the invoice information and route it to the appropriate person. So we certainly can support invoice processing through this platform as well.
Next question is, go ahead, Cliff.
I was just going to say, Philip did put a link in the chat for those of you who might be interested in finding out a little bit more about this. You can go in and upload some of your, or a form or two if you'd like to see this in action. we'd love to take a form that you might be interested in seeing how this could work in FastFlow, upload it to us, and we'll try and create a custom demo for you to see that in your environment. And he also put a link out there for the invoice processing for more information.
Okay, the next question is there a way to use info from other systems rather than retyping it in the forms?
Another good question. Pre-filling the form in FastFlow can leverage internal and external databases. Typically, it's best if we're leveraging SQL data and bringing that into the form. Often we'll be connecting to a human resources database or vendor database to populate the form. Certainly, you pre-fill, configure the forms to pre-fill that data and optimize the form entry.
And there's a related question to that. Will the workflow link to a budget system of any kind? Anything else you want to add about budget systems in particular?
But yeah, budgeting. I think typically we're bringing vendor information into a form, so we might be tying into a vendor database to identify maybe some contact information, but we may also have a database of budget information that we want to keep track of on a dashboard, and as we're completing new purchase requisitions or capital expense requests, we can have that information either communicate with another database or create one of our own that maintains that information, so we can have dashboards that are intelligent, provide some of that decision support for the CFO and other folks in finance who are interested in that budget information.
All right, got a few questions regarding Active Directory. Cliff, I'll give you a chance to address, our Active Directory integration, if you like.
Sure. So Active Directory allows us to populate some information in our database. We can link to an Active Directory structure to import users, and from there, we may still create custom configuration in FormFast, but we can identify those users through Active Directory and have Windows authentication configured so that when they're logged into their device, laptop, and on the network, we can automatically identify that person and pass credentials through so they can log on to FormFast without manually putting in their username and password every time. We have some enhancements that Tom may have already talked about in the roadmap. In the next few months, we'll be working on some additional capabilities on the Active Directory syncing side, because that's an area, obviously, we want that to be seamless for the users as they're logging in, not only to understand who they are and get them onto the system seamlessly, but also identify potentially some aspects of their security provisioning as they're logging on, as that's changing in Active Directory.
Okay, the next question is, can the automated process handle the approval of documents as well as policies and procedures? If so, can it collect input from various approval entities and also request for documents?
If I understand the question correctly, I think that is certainly something we can support with FastFlow, that as we're sending a document through this approval process, it may be called out in the form itself where we need additional information from the parties that are involved in that process, but we can require approvals at certain steps, and for documentation that's needed, perhaps we need a pricing, some pricing guide as we're putting in a purchase requisition or a capital expense request. If we require attachments or certain documentation as part of that process, we may prompt the user for that, or even require a document to be attached to a certain step in the process. And then that could also tie into content management. At the end of that process, we could take that content and store it along with the form that we're filling out in FastFlow, save that Excel spreadsheet or additional document in CM. So that can be referenced at any point during the workflow or even after the fact and from content management.
Looks like we have one more question here. Feel free to send in final questions, but this question is regarding search. Does the new platform have the ability to search for key terms through the document database?
I think this might, we do have the ability to search through workflows that are in flight and any of the content that's dynamic on the form. I'm not sure if this is, that's the spirit of the question or not, but when we're sending a workflow through a process, all of the fill text fields and checkboxes could be structured in a way that we could search through that and it's searchable. But the content of the form itself, the PDF underlying fields that were created from Form Designer, is not searchable content. The sort of static portion of the form is not searchable in that same sort of way. We could follow up with on that issue and see if we address that question.
All right, it looks like that may be it for the questions. As always, if you do have questions, feel free to reach out to us via formfast.com/contact. I want to thank Tom, Tim, and Cliff for filling us in on FastFlow and sharing that great content. Thanks, guys.
Thank you.
Thanks.
Before we get into our user panel discussion, I wanted to take a few minutes to talk about some of the services that we have to help you better maximize your use of FormFast. The resources are available to help you make sure that that your system is optimized and that you have the training that you need. And we have Kim Schrader on the line. She's our Director of Customer Service. Kim, are you there?
I'm here. Can you hear me?
I can.
Great.
And I thought it'd be great for you to share a little bit about some of the services that we do offer, starting with training. I know there's some interest in different types of training.
Sure. We actually offer a few different types of training. The most popular is an on-site at the hospital facility, which is typically done over, most of the time, a 3-day period. That is very popular due to the fact that we can have multiple staff attend. We also offer an option. Typically, it's done once a year at a specific location, and we hold the training session. This is really beneficial for facilities that might have a new member on board that has not yet been trained in our software. Dates to that for next year to be determined, so keep your eye out for it. The third option that we offer for trained staff members that just need a little bit more assistance is a WebEx version. Typically, we do those in like a 4-hour increment. So there's a variety of different ways that we can get your staff trained.
Excellent. And what about support? I'm sure most customers are familiar with our various support options, but could you fill everyone in on what's available to them?
Sure. So we typically offer our technical support to trained FormFast administrators, which means staff members who were involved in the process of getting implementation and then trained in the software. So our technical support team is there to assist in troubleshooting issues that you come across. And that is done on a 7 a.m. to 7 p.m. Business day, Central Standard Time. But recently, in the past year, we have now also began offering what we call an enhanced support option. And this enhanced support option really helps facilities that may have a high turnover or just don't have the staff to tend to the FormFast software. This enhanced option we offer pretty much lets our staff members be the FormFast administrators. So when you need items done, we actually will take care of this for you instead of having staff on site. You know, there are stipulations that go with that, but that is something new that we just recently started offering.
Thanks, Kim. And then financial services. Some customers may not be aware of some of the offerings we have for the financial side of the house.
Right, exactly. For those that don't know, we offer all the financials we can just set up. That starts with checks, which include AP, payroll, direct deposits. We can do bills and statements and invoices, W-2s, 1099s, and we even do government forms, UBs, and HCFAs. Our clients find this well used because there's so many changes a lot of times in software and checks. It really does save a company a lot of money in purchasing pre-printed stock on a lot of these items. So for those that don't know, this is something that we can set up within our software.
Perfect, thanks. We also have Maggie Pena on the line, and she is our Director of Solution Consulting. I want her to say a few words about some of the services we have around optimization and consulting hours. Maggie, are you there?
Thanks. Yes, I am. Thank you, Aaron. So yeah, as far as professional services, some of the things that we offer to assist you as our customers is we have professional services hours to help with software upgrades, server migrations, optimization assessments, where we can go on site and do just an assessment of your current FormFast environment and just give you some best practices and just different ways that you can optimize the use of your current system. Again, you know, like I said, from software upgrades to server migrations, anything that we can do to help you, we have our professional services team to assist with that.
Excellent. And we do have a question that came in for Kim, I believe. Request for changes to existing forms in FormFast sent to customer service.
Okay, that's definitely something that we offer and is utilized quite a bit. If you have a request to forms that we have created, existing forms, you can contact your account manager and we can get you set up so that we can do that. We even offer, if you don't have the time or the ability, we can upload those changes for you as well as making them.
And Philip just provided a link to the support section of our website. Go there and reach out for more information about all those things we just mentioned. Thanks to Kim and to Maggie. And we are going to move on to the next portion of our meeting, which is our user panel discussion. And we are pleased to be joined by a group of our customers to share some of their insights and experience, and I believe we have them all on the line. We're just going to do a roll call here. First, Maggie, apologies, Margie Gowdy.
I'm here.
Excellent. Stacy Westfall.
I'm here.
Sharon Clayton.
I'm here.
Naomi Kirkpatrick.
I'm here.
Glenda Hayes.
I'm here.
I believe we're all accounted for. Excellent. Well, what I'd like to do to get us going in the discussion here is go around the circle and give you each the chance to introduce yourself and give us your name, your job title, the name of the facility that you're representing, where that's located, the bed size, and your role in the organization. And we will start with Margie.
Gee, thanks. I always like being first. I'm Margie Gowdy. I'm the Clinical Document Manager for ACES Corporation. We are currently located in Franklin, Tennessee, and I manage 25 facilities. Those 25 facilities are built on 5 different servers for the admission process and 5 different servers for the web form imprint. I wish I could tell you exactly how many beds that involved. I'm going to say probably 1,200. And forms, we probably have about 27,000 pages.
Well, that's a lot of surfaces. Fantastic. Well, I appreciate you being here. Next, we'll go to Glenda Hayes.
Hi, I'm Glenda Hayes, and I'm representing Christus Health. We are a healthcare organization that owns hospitals primarily in Louisiana and Texas. We have 23 different facilities built on FormFast for the admission and process and web form imprint. We use 5 different servers, and we're probably about the same bed size and surface size as the previous lady.
Excellent. Welcome as well. Next, let's go to Naomi Kirkpatrick.
Hi, I'm Naomi Kirkpatrick. I'm Systems Analyst for Maine Health, working at Lincoln Health in Damascotta, Maine. We're a small facility, about 25 beds, so you can imagine the size of the other hospitals that have been described are pretty phenomenal. But we're part of Maine Health, which puts us out there as part of a much bigger organization. I provide support as an analyst for Meditech. We're on client server 566, and I'm also their FormFast administrator, so I manage the server and I'm responsible for creating and updating forms for fast print and on demand. I assist the users with Form Designer, et cetera, in creating forms, and we are quite multitasking here in such a small facility. That's about it.
Perfect. Next, let's go to Stacy Westfall.
Hi, I'm Stacy Westfall. I am the Assistant Director in Information Technology. I work at Columbus Community Hospital. We are located in Nebraska. We are just a single standalone facility, 46-bed hospital. My role has always been on the clinical side of everything that we use in the hospital, and we use McKesson Paragon as our main system. I have been lucky enough to be using FormFast since we brought it up, so I am pretty much the single person here that does everything with FormFast. We have about 500 jobs built and about 700 merges that we use.
Wow, that's great. And finally, we'll go to Sharon Clayton.
Hi, I'm the Director of Health Information Management at Phelps County Regional Medical Center. We're located in Rolla, Missouri, which is kind of central Missouri. We are a standalone facility. We're our own little system here. We're licensed about 240 beds. My role in the organization with forms is I'm over the forms committee and over the individual that builds our forms and our forms process. So we have, I'm honestly not sure how many forms we have. We're probably around 1,000 forms that we have built that we use.
Fantastic. So thanks again for everyone for taking the time to be here. What we wanted to do with this section is touch on a couple of different things. We know that there's some individuals who are attending this event to find out more about FormFast. They're not FormFast customers yet, but trying to see how it works and some of the value that other hospitals are getting from it. Others are long-time FormFast users but want to learn how to use it better. So we want to talk a little bit about your advice to them, ways to optimize the system. But let's start with, for those that aren't using FormFast yet, going back into their shoes and thinking about how processes were before FormFast was implemented. What I'd like to do is go around the group and talk a little bit about before FormFast, what were the processes like, what were some of the challenges that you were facing, and why was FormFast brought in to address those? And I'll start in the middle of the group this time. I'll start with Naomi.
We actually have had FormFast since, I believe, 2006. And what was interesting was it went strong for a couple of years, and then we lost our administrator. So I was brought on board to help upgrade FormFast, and that's just been within the last couple of years. So we had a few years in between there where forms were not probably as organized and distributed the way that they could be with FormFast, and we're using on-demand. So in bringing the server up to date and bringing FormFast where it needed to be on the current version,